29 medicine-free stomachache remedies you never knew about. Everyone experiences an upset stomach and indigestion, or dyspepsia, from time to time after eating or drinking. The condition is usually no cause for concern, and it is often possible to treat the symptoms using home remedies. Try these natural remedies to make an upset stomach feel better without medicine. Drinking water. The body needs water to digest and absorb nutrients from foods and beverages efficiently. Being dehydrated makes digestion more difficult and less effective, which increases the likelihood of an upset stomach. For those with digestive issues, it is imperative to stay hydrated. Vomiting and diarrhea can lead to dehydration very quickly, so people with these symptoms should keep drinking water. Carrot and mint juice. The carrot provides nourishment and peppermint soothes your upset stomach. Boil 4 sliced carrots, 4 cups of water, and 1 teaspoon of dried peppermint. Cook about 15 minutes on medium-low. Then blend the mixture until smooth. You can also add a pinch of ground ginger and a squeeze of lemon juice. Peppermint. In addition to sweetening the breath, the menthol in mint may help with preventing vomiting and diarrhea, reducing muscle spasms in the intestines and relieving pain. Raw and cooked mint leaves are both suitable for consumption. Try boiling mint leaves with cardamom to make a tea. Mint leaves are widely available in health stores and supermarkets. Try sucking on mint candies as well to help reduce the pain and discomfort of heartburn. Spearmint. Like mint, spearmint is a common remedy for many digestive complaints, like nausea, stomach and intestinal spasms, gastrointestinal infections and diarrhea. Drink a prepared spearmint tea. Drink spearmint tea several times daily until symptoms improve. Ginger. Ginger is a common natural remedy for an upset stomach and indigestion. Ginger may also help to reduce nausea, vomiting, and diarrhea. Ginger contains chemicals called gingerols and sugarols that can help speed up stomach contractions. This may move foods that are causing indigestion through the stomach more quickly. Try adding ginger to your food or drink it as a tea. Ginger tea is widely available to buy in supermarkets. Rice tea. A rice tea will help to settle an upset stomach or stop diarrhea. Boil 1/2 cup of rice in 6 cups of water for about 15 minutes. Strain out the rice, then flavor the water with a dash of honey and drink while still warm. Rice. Plain rice is useful for people with many types of stomach complaints. It can help by adding bulk to the stool, absorbing fluids that may contain toxins and easing pain and cramps, because of its high levels of magnesium and potassium. Rice is also part of the brat diet that doctors often recommend. Burnt toast. An old wives' tale that strangely seems to work for many people. Burnt toast is great because the char absorbs toxins that are making you feel ill. Add a smear of jam to make it more palatable. Avoid lying down. When the body is horizontal, the acid in the stomach is more likely to travel backward and move upward, which can cause heartburn. If you have an upset stomach, try to avoid lying down or going to bed for at least a few hours until it passes. If you need to lie down, prop up your head, neck, and upper chest with pillows. Apple cider vinegar. A mixture of 1 tablespoon apple cider vinegar, 1 cup warm water, and 1 tablespoon honey will ease indigestion and may alleviate cramping and gas in your upset stomach. It can also decrease the discomfort caused by heartburn. Take a warm bath or use a heating bag. Another great addition to the list of medicine-free stomach ache remedies is placing a hot water bottle or heating pad on your upset stomach. Heat may relax tense muscles and ease indigestion, so taking a warm bath may help to ease the symptoms of an upset stomach. Crap diet. If you are constipated, try the crap diet. It stands for cherries, raisins, apricots, and prunes, all fiber-friendly foods that should get your system moving and ease your upset stomach. Brat diet. Doctors will often recommend the brat diet to people with diarrhea. BRAT stands for bananas, rice, apple sauce, and toast. These foods are all starchy, so they can help bind foods together to make stools firmer. This may decrease the number of stools a person passes and help ease their diarrhea. Many of the foods in the BRAT diet are high in nutrients such as potassium and magnesium and can replace those lost through diarrhea and vomiting. These foods do not contain substances that irritate the stomach, throat, or intestines, therefore, this diet can soothe the tissue irritation resulting from the acids in vomit. Yogurt. The probiotic qualities of yogurt make it a good cure as it eases digestive discomfort and boosts your immune system. Just make sure to choose non-fat plain yogurt without added sugar or flavors. Avoid smoking and drinking alcohol. Smoking can irritate the throat, increasing the likelihood of an upset stomach. If the person has vomited, smoking can further irritate the throat tissue already sore from stomach acids. As a toxin, alcohol is difficult to digest and can cause damage to the liver and stomach lining. Yarrow. Yarrow flowers contain flavonoids, polyphenols, lactones, tannins, and resins that may help to reduce the amount of acid that the stomach produces. They do this by acting on the main digestive nerve, called the vagus nerve. A reduction in stomach acid levels can reduce the likelihood of heartburn and indigestion. Eat young yarrow leaves raw in a salad or cooked in a meal. It is also possible to make yarrow tea by adding 2 teaspoons of dried or ground yarrow leaves or flowers to boiling water. Caraway seeds. Nibble on a handful after eating your meal, or if you feel gassy. Caraway seeds are packed with vitamins and minerals, which inhibit the growth of bad bacteria that causes indigestion, gas, or bloating. Avoid difficult-to-digest foods. Some foods are harder to digest than others, which increases the risk of an upset stomach. Anyone with an upset stomach should avoid foods that are fried or fatty, rich or creamy and salty or heavily preserved. Fennel. Fennel is also one of the best stomachache remedies for indigestion, gas and bloating. Sip a fennel tea or chew on a few fennel seeds. Fennel supports digestion, reduces gas, helps with cramping, and reduces nausea from an upset stomach. Basil. Basil can reduce gas, increase appetite, relieve cramping, and improve overall digestion. Basil also contains eugenol, which may help to reduce the quantity of acid in the stomach. Basil also contains high levels of linoleic acid, which has anti-inflammatory properties. Try adding a couple of fresh basil leaves to meals until the symptoms lessen. Lime or lemon juice, baking soda, and water. Mixing lime or lemon juice in water with a pinch of baking soda can help to relieve a variety of digestive complaints. This mixture produces carbonic acid, which may help to reduce gas and indigestion. It may also improve liver secretion and intestinal mobility. The acidity and other nutrients in lime or lemon juice can help to digest and absorb fats and alcohol while neutralizing bile acids and reducing acidity in the stomach. Try mixing 1 tablespoon of fresh lemon or lime juice with 1 teaspoon of baking soda and 8 ounces of clean water. Cinnamon. Cinnamon contains several antioxidants like eugenol, cinnamaldehyde, linalool and camphor, that may help ease digestion and reduce the risk of irritation and damage in the digestive tract. Other substances in cinnamon may help to reduce gas, bloating, cramping, and belching. They may also help to neutralize stomach acidity to reduce heartburn and indigestion. Try adding 1 teaspoon of good quality cinnamon powder to your food. Alternatively, try mixing the cinnamon with boiling water to make a tea. Do this 2 or 3 times a day to relieve your indigestion. Cloves. Cloves contain substances that may help to reduce gas in the stomach and increase gastric secretions. This can speed up slow digestion, which may reduce pressure and cramping. Cloves can also help to reduce nausea and vomiting. Mix 2 teaspoons of ground or powdered cloves with 1 teaspoon of honey once a day before bedtime. Or make a clove tea, which you should drink slowly once or twice daily. Cumin. Cumin seeds contain active ingredients that may help reduce indigestion and excess stomach acids, decrease gas, reduce intestinal inflammation and act as an antimicrobial. Mix 2 teaspoons of ground or powdered cumin into your meal. Alternatively, add a few teaspoons of cumin seeds or powder to boiling water to make a tea. Figs. Figs contain substances that can act as laxatives to ease constipation and encourage healthy bowel movements. Figs also contain compounds that may help to ease indigestion. Try eating whole fig fruits a few times a day until your symptoms improve. Aloe juice. Aloe juice can provide relief by reducing excess stomach acid, encouraging healthy bowel movements and toxin removal, improving protein digestion, promoting the balance of digestive bacteria and reducing inflammation. Drink 10 ml of aloe juice daily for relief from heartburn, flatulence and belching, nausea and vomiting and acid and food regurgitation. Licorice. Licorice root may help to reduce gastritis, or inflammation of the stomach lining, as well as inflammation relating to peptic ulcers. Drink licorice root tea several times a day until symptoms improve. Coconut water. Coconut water contains high levels of potassium and magnesium. These help to reduce pain, muscle spasms, and cramps. Coconut water is also useful for rehydrating and is a better option than most sports drinks. Slowly sip on up to 2 glasses of coconut water every 4 to 6 hours to help ease upset stomach symptoms. Bananas. Bananas contain vitamin B6, potassium, and folate. These help to ease cramps, pains, and muscle spasms. Bananas can also help by adding bulk to loose stools, helping to alleviate diarrhea. When to see a doctor. Older adults and children can become dehydrated much more quickly, so they should seek medical attention for vomiting and diarrhea that lasts for more than a day. For most people, symptoms should go away within a few hours. It is best to seek medical attention if the following symptoms are present: continual or uncontrollable vomiting or diarrhea, chronic constipation, fever, bloody stool or vomit, inability to pass gas, dizziness or lightheadedness, arm pain, unintentional weight loss, a lump in the abdomen or stomach, difficulty swallowing, history of iron deficiency anemia or associated conditions and pain when urinating.